My name is Dr. Faye Sharpley. I am a haematology consultant here at the Christie at Macclesfield in the northwest of England. I trained in Oxford and I also spent some time at the National Amyloidosis Centre in London. I have a particular interest in multiple myeloma and also AL amyloidosis. The OnControl device is a powered device used to perform bone marrow biopsies. Currently, bone marrow biopsies are required when someone suspects a haematological malignancy or a solid malignancy that's gone to the bone marrow. And we have to use a manual needle at present, which requires actual brute strength from the operator to get the needle into the bone. Using a powered device system, which is what OnControl is, you have an automated device which allows the operator, or it's easier to use for the operator to get the sample from the bone marrow, which means that the procedure is easier for the operator, quicker for the patient, and means that the patient hopefully has less discomfort during the procedure and the sample quality is improved. I first encountered the OnControl system in 2019. I was at the National Amyloidosis Centre in London then. A patient asked whether he could have the OnControl device for his bone marrow biopsy as he had a previous positive experience. I was unaware of the powered device system at that point in time. I then returned from London to Oxford to complete my training, and I then explored the possibility of introducing the OnControl device needle there. With the help of Teleflex and also the support of the haematology department, I successfully submitted an application to the Trust's Technology Advisory Group Board for a trial of 100 procedures using the OnControl device system. The trial was a huge success, and now the Trust widely uses the OnControl device system. One of the main benefits of the OnControl device system was the improved patient experience. We conducted a questionnaire-based survey of 100 patients using the manual needle and 100 patients using the OnControl device system. And what we found was that patient experience improved in the OnControl group. So patients found the procedure better than expected in 40% of cases using the OnControl device system versus 32% in the manual control group. Sample quality also improved using the OnControl device. The percentage of inadequate aspirates using the manual needles was 39% compared to 14% using the OnControl device system. But also the quality of the bone marrow trophines also improved. So the percentage of inadequate trophine samples using the manual needles was 31% compared to just 13% using the OnControl device system. One of the huge benefits has been no patients have required a repeat biopsy using the OnControl device system. This compares to 13.4% of patients that require a repeat biopsy using the manual needles. In our audit of 100 patients, 13.4% required a repeat procedure, so that's quite a high proportion of patients. And what that means for the patient is that they don't have a diagnosis. There's a delay in their diagnosis, and there's a delay in them starting treatment because they have to reattend for a repeat procedure. So that's been a huge saving for the patients in our trusts because they can reach a diagnosis quicker and start treatment sooner. The use of Entonox reduced in the OnControl group compared to the manual needle group. So 35% of patients required Entonox in the OnControl group compared to 47% of patients using the manual needle type. The duration of the biopsy was much shorter using the OnControl device system. The average time taken per procedure was 58 minutes using the OnControl device compared to 1 hour 5 minutes using the manual needle type. This means a saving of 7 minutes per procedure, and it means that 6 extra patients can be booked in per month. The majority of operators found the OnControl device system easy to use, and 83% would be happy to use the device again. We were slightly apprehensive about the noise of the device. We had understood that using a powered device system would mean that there would be a noise as the tool was used, and we were worried that that might make our patients waiting for a biopsy anxious and nervous about the procedure. But we didn't actually find that in practice. We demonstrated the device to the patient beforehand, and they seemed very comfortable with the noise. So when it was used in practice for their bone marrow biopsy, they weren't alarmed and they didn't report that that was a problem for them. Even though the OnControl device seems more expensive per se, it does lead to a cost saving overall. Our trust could save £50,864 per year by using the OnControl device needles rather than the manual needle type, and this is due to the reduced need for repeat procedures and also the reduced time per procedure. We now give patients in Oxford the choice whether they would like the powered device or the manual needle for their bone marrow biopsy. And I would say that the majority of patients would now opt for the powered device tool. So in conclusion, the OnControl device system has led to improved patient experience, improved sample quality, but also a reduced time per procedure and a reduced need for repeat biopsies. This has led to a cost saving for our trust in Oxford. Overall, our experience has been excellent.